This conference will now be recorded.
अद्य शुक्रवासरः अथवा भृगुवासरः श्रावण शुद्ध द्वादशी दिनांक 31 जुलै 2020 सहस्रयोगम असं बिलवादी तैला शंखं चक्रं जलौकान्ततमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृत्यां शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगगनप्रौढदावानिलीलम् प्रौढदावाग्निलीलम् ब्रह्मणो हि समारब्धा मात्रेयाद्येषु पूजिताम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम् आयुर्वेदरतं वन्दे माधवाख्यं महागुरुम् आयुर्वेदामृतं सर्वं शिष्येभ्यो यः प्रदत्तवान् द्रष्टाज्ञानी दृष्टकर्मा कृतकर्मा तथैव च अध्यापको विषक्श्रेष्ठो महान् संशोधकस्तथा गुणैरेतैः समुदितैः यत्कार्यं प्रतनोति सः समृद्ध्यर्थं हि कार्यस्य वयं नु प्रयतामहे सरस्वत्यै नमो यस्याः प्रसादात् पुण्यकर्मभिः बुद्धिदर्पणसङ्क्रान्तं जगदध्यक्षमीक्षते आत्रेयं प्रथमं वन्दे आयुर्वेदजगद्गुरुम् आयुर्वेदामृतं सर्वं शिष्येभ्यो आयुर्वेदामृतं सर्वं गृहीत्वा हि सुरेश्वरात् अग्निवेशादिकेभ्यो यत् प्रयच्छत्वं सत्तमः प्रथमं तन्त्रकर्तारम् अग्निवेशं नमाम्यहम्। आसन बिलवादी आसन बिलवादी तैल असन बिल्व बलामृतपाचिते मधुकनागरक त्रिफलान्विते पयसि तैलविधं पयसा पचेत् नयनकर्णशिरोहितमुत्तमम् नयन also. So this is available and very well used as such. So Madhukanagara Trifala, this is Kalkadravya and Asana Bilva Balamrita Kashaya plus Kshira Payasa Pache Tailamidam Nayana Karna Shirohitam Uttamam Karna विषये एतस्य उपयोगः क्रियते किन्तु न केवलं कर्णरोगे अपि नयन शिरोहितं तर्हि एतदर्थं प्रयोक्तव्यमिति Akshikkarna-Shiroroga. So if anybody has used this for Akshiroga or even for Shiroroga, might be we can use it in the form of Nasya. Karna Purana we are already, I am also doing or advising. And medicines are simple. Asana, Bilva, Bala, Amruta. Nagaraka, Triphala. So there was one dialogue between Politker sir and Pansarkar sir long back. And I have told this in somewhere in Charakwachan long back. Pansarkar's specialty was combination of medicines. And this was used to be very peculiar combination. And some very difficult and complicated cases were solved by him. That was Professor's experience. Of course, that is my experience as well. And Sir asked him, Payasi, Payasa Pache. Payasi व Payasa असे दोन दाखा आले आहे. Good observation. Can't say. Asana bilva balamruta pachite payasi. That might be Kwatha, and Payasa is milk. So generally it is not given like that. And Madhukanagara Trikalan Vite, this is also Saptami. So Asana Bilva Balamruta Pachite Madhukanagara Trikalan Anvite Payasi. So Kwatha is to be prepared, and then the Kalpa Dravya are also to be mixed in that. And then Payasa Taila Midam Pache. So that might be one payas is jala and other payas is milk. So there are two things. So anyway, as I said, this is a better choice. And secondly, while preparing taila or bhrata, they said that the kalka dravya and the kvata dravya all mix together and then put sneha into that. So here it is Sati Saptami Rachana. So Pachite पयसी मधुक त्रिफलान्विते सति idam tailam payasa pachet, that is along with the use of the milk and such. But then this is good that it reflects some different meaning from that. So Kolotkar sir asked Fansarkar sir that how he has been able to make such combinations particular for a particular patient. Surprisingly, Fansarkar answered him that I have read Uttarsthan of Marpata hundreds of times for that. Now, this is very strange. Generally, one is emphasized or emphasizing on reading Charaka. And then the philosophical part, peculiarly, is found in Charaka Samvida. But reading Ashtanga Hriday Uttarasthana hundreds of times, what might be the interest in that? Now, the fact is that there are very simple combinations for a specific purpose. So, if we want to understand the formulations, which are not more than 3-4 dravyas or something like that, and working on a peculiar condition or something like that, then it is best studied from Uttarasthana. And surprisingly, this answer was given by Fansarkar. Otherwise, it is very difficult to say when somebody is praising you and you just say you are welcome or something like that. But this answer was revealed by Fansarkar, and that is quite eye-opener for all of us. So anyway, we try to understand this concept, this message, and try to follow it in our practices. I don't understand why Kalka Dravyas are different and Vata Dravyas are different. I had talked about this long back. That basically it is the Kalka Dravya that gets transmitted into the oil or ghee. The Agni is helpful, particularly for providing time period. Once you are making a decoction and then in the decoction you are trying to make the sneha siddha. So you get sufficient time and you put in sufficient heat energy. That is another important aspect. And actually it is the Kalka Dravya that creates a samskara on this Sneha Dravya. So that is more important. Of course, the Kvata has also some meaning and importance. and why a particular kvata or dravadravya is selected for the samskar. May it be kanji, may it be milk, may it be kvat, may it be swarasa. So there are so many things which are already there as dravadраvyas. But the whole combination is working in a desired way. Now, to understand the logic behind this is quite difficult. But long back when I was head of the department of Ayurveda in Taila Maharashtra Vidyapeeth, we were running a course Abhyangamardhan Tantrajna on Ayurvedic massage as such. Simultaneously, we were working on Triskanda Kosh project. So Dakshan Kosh, Hetu Kosh was underway. And then I came across with Limay Maharaj. So it was his sixth generation practicing massage as a social service free of cost. And he was using only groundnut oil for all patients. And there are varieties of patients, Vataved. So I was stuck up with this because in Aushadha Kosha, there are around 10 or more pages on a particular Sneha Dravya for a particular disease. So varieties of oils with varieties of preparations and specific uses wherein that particular oil is to be used. Now this is L. Mahadevan's book is a good book for that. He remembers many sutras by heart. So for which condition, which sneha is to be used, that is at least the tip of tongue. But for other people, this book is good and it's in English, so anybody else can learn that. But what I emphasize is there are so many formulations and there are around 10 or more pages in Aushadha Kosha for use of a particular oil in a particular condition, in a particular disease. And whereas this fellow was doing only manipulation with groundnut oil and was having very good results. So what actually the results are? That was my question. Then I tried to search Mardana in Kosha, and there is hardly a quarter page on Mardana. So very few records as such, and this manipulation technique is not emphasized much in the text. It is the selection of the oil or sneha dravya which you want to use for massage that carries more importance. But still, I was seeing that he has very good results. So I started searching what is actually or what we do massage. This is a general question. Abhingo Acharyan Ditam Sarjarashrama Vata Drishti Prasada Pushpa technique. Basically, Vataha, that is the main characteristic for which we use in varieties of cases. Vayu Dhatu Kshayat Kopo Margasya Avranenva. And then that Vayu is exhibiting certain symptoms, Shula, Vedana, Pida, Daha, Ruja, etc. Now in Lakshana Kosha is Lakshana is associated with varieties of diseases or disease conditions and such. So there are minimum 10 pages on Ruja, there are minimum 10 pages on Shula, Vedana, etc. etc. To have a differential diagnosis of Shula, Vedana, Pida, it's a Herculean job, which we did in Triskanda Kosha and which we are doing in Pratipadika Kosha as well. And there are so many factors associated that need to be considered in a logistic way. And this is a tough job, there is no doubt about that. But then, when he is using only a single oil and whatever other results are of the sneha dravya and manipulation, that's all. So I started thinking about what is pain, what is Vedana, what is Shuddha, etc. How it occurs, and how Snehan and Mardhan counteract it, or something like that. So then this is not only associated with the dosha, it is associated with the dushya as well. Sira, Snayu, Pandara, Mausa, Meda, these are varieties of dushyas. Some of them are Upadhatus actually. And to certain extent even Asti. This is a dushya. So why a pain in a particular part originates? And what is the combination of dosha, dusha, etc.? What is the role of armor in that? And other factors, psychology and other things, how do they act on that? And if we try to analyze all the situation properly, then we may arrive at a selection of a particular dravya or selection of a particular sneha dravya, so to say. Maybe taken internally, maybe externally, maybe basti or something like that, nasya, etc. So, if we understand the situation properly, then only we'll be able to deal with it properly. That is the issue. Now, bringing all references together and thinking of them in a holistic manner and arriving at a proper conclusion is again a tough job. But with the use of computers, it is much better now, much more easily handled. No doubt, our brain itself is a very good computer, more greater than this artificial, because we have created it. Ours is a gift or something like that. But still, this can be used as a tool, and that can help us. So the diagnostic software, the treatment software are very good tools. By compilation of textual references in a particular manner, in a particular way, and then retrieving the data in a particular way. So I learned from Triskanda Kosha how to extract data from the text, in what way it has to be extracted. And we have to keep the utility in mind. For what purpose I am doing this? If Triskanda Kosha is my purpose, then how should be the collection? If Dravyaguna Karma Kosha is my purpose, then how should be the collection, etc. And no doubt, I am putting all my efforts right now in this Pratipadik exposure to have a real pleasure of all treasure of the texts. But still, the thought process is different issue. This is just collection of data. Understanding the underlying principle is more important, and that is again a tough. So we should have a holistic approach to understand as a whole, and then a focused approach through Triskanda Kosha, Paradipatik Kosha, or something like that. A combination of these two is helpful. Now we are trying to do both. I am trying to read these texts, understand as a whole, and I am doing on working on Pratipadika Kosha to have a focused approach as well. So what I mean to say, at that time there were many Vaidyas who were practicing massage as well, were good in Ayurveda and good in massage as well. Rishikesh Maitre, Aarti Dev, or Aarti Sandhu at that time. And Ganeshan Marda, etc. So I thought of a good chance to understand the dosha dusha samurchana, the samprapti that is getting involved in manifestation of a disease by symptoms, and then counteracting it with maybe medicine, maybe external treatment, etc., etc. So, Shur, Vedana, Ruja, Pida, etc. are very important because patients suffer from that and they come for that symptom that there is some pain. Now, it is the duty of the Vaidya to understand the reason behind that, understand the saprapti behind that, and counteract it properly with proper treatment. And then, for that, this continuous reading of text and focused approach in the form of this in the kosha or Pratigadika kosha is important or is beneficial. But still, this brings references together. The thought process has to be there to understand how it occurs. And I have been thinking on that. Say, pain in cancer is something very difficult to handle. It's very severe. And I have been struggling with this for 35 years now, pain of cancer. So, where do we find the answers to these? Whether cancer can be found in our text or not, etc. These are again varieties of aspects associated with this. So, for that matter, I have in my mind to read after this Sahasrayogam, Madhav Vidan Madhukoshtika first chapter, which is a good tika for understanding Ayurvedic principles in diagnosis. It considers the Dana Panchaka as a whole. And there are so many arguments, and the commentary is very good. So it was my favorite when I first learned it. And then I taught to many students at that time. Now, recently, I have not read it for many years. And this is not a text that is to be taught at Gurukul. So, this has not been said like that. But this is one aspect on diagnostic part. How do we consider dosha, dushya, samprapti, etc.? And try to understand manifestation of a disease with particular symptoms, the sadhya, sadhyatva, etc. And then enter into Dravya Guna Karma kosha and Aushadha, of course. Then, how do we select medicines? On what grounds? And starting from single medicines, we go to formulations of varieties of drugs with varieties of kalpanas, etc. As where we are here, we are seeing that kalpa and kvata, these two are kalpanas. So, in a single formula, there can be kalpanas like this. In Chavanpraya, there are varieties of kalpanas. So, the role of kalpanas in a particular formulation has to be has to be understood. And we try to match these two aspects together, understanding the disease and understanding the treatments. And when there is a perfect match from both the sides, then we have tremendous results or miraculous results, so to say. Now, this is not a chance happening. There can be chance happening at certain times, but really speaking, it's a science. And we need to understand the science, the cosmic relationship behind this. And Pansarkar used to say what exactly has happened and what exactly needs to be done. That should be understood by way. Now, this what is very important. And as such, it comprises so many things that to consider all these factors together is a tough job. Still, there can be varieties of Vaidyas at different levels. One may just understand what Charkacharya had said. These are Panchashan Mahakashaya with particular objective, karma objective. One who wants to understand that Sambhaniya is required or Vedaniya is required or may pick up a dravya, obtain and use it. That's all. Even that also works. The regular way is understand a disease, how it is formed or how it gets generated. What are the causes? What is the samprapti? What are the manifestations? What are the conditions or avasthas? And whether sadhyavastha, asadhyavastha, and accordingly you see the principles of treatment that is elaborated in the Chikitsasana. So this is a regular method. यस्यात् रसविकल्पज्ञा साच्यदोषविकल्पवित् न स गुह्येत् विकाराणां हेतुलिङ्गोपशान्तिषु. This is another method. Then 63 varieties of dosha, 64 varieties of vicharana sneha, that is another method. And the matrix that has been said in Siddhisthana about Vata, Pitta, Kapha, Ama, Purisha, and Rakta. This is totally different matrix. So there will be Vaidyas on varieties of levels thinking in a particular way based on their knowledge and their experiences. Param prayatnama atishtet bishak swaguna sampati. We should try our level best to have swaguna sampat, etc. And then we will be able to conquer any situation which is sadhya, and if it is asadhya, at least we can maintain it on the upper category. That is another important aspect. And pratyakshaya, when nothing is possible or something like that. And that's the requirement of the society. And that is how we'll come up across the globe. So, no doubt this is Herculean job, and no doubt that all will not be that much knowledgeable or that much experienced or something like that. But still, whoever at whatsoever level may keep on upgrading self to higher level. And the way is what we are trying to do right now. But understanding this, memorizing this, using this practically, this is one aspect. One should go beyond that. Try to understand the rationale behind that. Why this particular combination is useful in this particular scenario? Why this particular combination has this particular fellowship? That we need to understand. And also at disease level, why this particular combination of dosha, dusha Agni, etc., has this effect, this kind of disease, these kinds of symptoms, etc. And bridging the gap between the diagnosis and the treatment. That would be good enough. So what I propose right now is thorough understanding of the text and just going beyond the Vachartha. That's a basic need. Vachartha, understanding Vachartha. Lakshyartha, Vyangyartha, and then relationship between two sutras, etc. And understanding in a holistic manner about an entity. It may be disease, it may be a dosha, it may be Agni, anything like that. And then properly implementing the things in our practices. So no doubt there are varieties of things like this, and so what I propose is after Sahasrayogam we'll go for Madhavendra Madhukoshtika. Anyway, that is important for college students as well. And many Vaidyas are teaching it. That is also well known. And I know many of my students are teaching it well. There is no doubt about that. But still, when I start teaching, I have some different views. And that may provide some different insight. That is another important aspect. And secondly, we try to understand the rationale behind the formulations. That is most important aspect in this. So these two will form a base for understanding the disease and understanding the treatment, etc. And then I may take up Chakradatta later on after Madhavendra Madhukoshtika. And then we decide which text to be taken. Of course, we want to go Sharandhar and Bhav Prakash and Yogatnakar as well. And maybe to a certain extent Vaisheshya Ratnavali, because it comprises many diseases that are there. So anyway, what I feel right now, Asana Vilvadi Taila, I'm using only for Karna, but it is for Shiro Netra Roga as well. And maybe done as a Nasya, and maybe Shirobhenga or something like that. There is no mention in what way it is to be used. And this particular thing that Pachite Payasi, Madhaka Nagaraka Phalanvite. So the Kalka Dravya, the Kwatha Dravya, and milk. So this is more clear over here that why it has been said that Kalka and Kwatha you mix together and then put Sneha into it. So I think it's better we go ahead with this. Nagaradi Taila. Nagarasya tule dve staha स्यात्तुलां चित्रकस्य तु देवदारु तदर्धं स्यात् तदर्धं विकरञ्जकं मुस्तारि मेद त्रिफला क्षत्री दन्त्यर्कगुग्गुलुः तदर्धमिति संगृह्य विद्रोणे सलिलेक च तैलाढकं विपक्तव्यं कार्षिकैः कल्पितैः इमैः षठी पुष्करशाङ्गेष्टा हपुषा पिप्पलीत्रयं भाङ्गीरास्नामधुच्छिष्टं निषाद्वय वचां बुदं चातुर्जातं च मञ्जिष्ठां चन्दनागुरुपद्मकैः औसीलोधरवराकुष्ठैः द्विगुणक्षीरसंयुतं तत्पक्वं दिविनिहन्त्याशु मुखजान् सकलामयान् पानाभ्यञ्जनकण्डूषनस्योन्मर्दनबस्तिभिः. अरे वाह. So, whether this is available in Nagaradi Taila, I have heard this part for the first time. It's quite big part. And Mukhajan Sakalamayan. So all Mukhajamaya. Pana, Abhyandana, Gandusha, Nasya, Unvardana, and Basti. So we may have to think about this more seriously. Is this available in the market, Nagaradi Taila? No. Nobody is aware. So Nagara, do tula, Chitraka, 1 tula. Devdaru Tadardhan said, Ardha tula Devdaru, Tadardhan Vikaranjanam. And Chaturthansh tula Dvikaranjan. Mustari Meda Triphala Chatri Danti Arkamudguluhu Tadardhan. So half of that is Mustari. Now Tadartha is whether half of Dvikaranja, altogether half of Dvikaranja, or individually half. Samriya Dvidrone Salile Pache, Dvidrona Salila. Tailadakam Vipaktavyam Kashikahi Kalkitehi Ime, Shati Pushkara Shangeshta. So these are all one Karshika, one Karsha, Kalkadravyas, and Nagaraj is available. So a Pottakal. So this is good. Nagaraj is a Pottakal. Will Mahadevan sir differentiate Asana Vilvadi for Pradhana sinus headache? Asana Eladi for Vata tension headache. Asana Manjisthadi for Pitta Pradhana vascular headaches. So these also are available. I am not aware. Asana Bilwadi and for Kapha Pradhan. Asana Eladi for Vata and tension, and Asana Manjisthadi for Pitta Pradhana vascular diseases. So good input. Anyway, we go ahead and see what is. Shakti Pushkara Sangeshtha Gunja Hapusha Pipali Traya Pipali Mula Veja Pipali Bharangi Rasna Madhuchishta Nisha Dvaya Vacha Ambuda Musta Chatur Jataka Manjishtha Chandan Agaru Padmaka Mausi Lodhra Vara Pushta. So Chandan and Agaru, this might be just Madhyamapaka. There is one mention, Ganesh once mentioned that this Madhyamapaka, Chikkadapaka is what it is called, is useful for Nasya, is useful for Abhyanga both, and of course for intermittent use. So if it is Madhyamapaka, then it can be used for all purposes. नागर 200 फल, चित्रक 100 फल, देवदारू 50 फल, द्विदर्कंज 25 फल. Now he has taken everything half of Vikaranja. Musta, Arimeda, Tripala, Dhatri, Chatri, sorry, Danti, Arka, Gubbulu. Otherwise, as per part, this might be 12 and half pala together. So this is again a difference. With Drona, we may have to calculate with Drona and whether it is 8 times, 4 times or something like that. चतुर्थावशिष्ट कषाय क्षीर एक प्रस्थ प्रिपेयर तैल with above drugs कल्क स्नेह द्रव द्रव्य सर्व मुख रोग. It is used as पाना अभ्यंग गंडूष नस्य उन्मर्दन and basti. The only thing is there any mention of milk? How much to be milk added or something like that? That we may try to. मांसिलोदर वराकुष्ठैः द्विगुणक्षीरसंयुतम्. So Dviguna that is the thing. Dviguna of what? That might be Taila. Tailadakam Vipaktavyam. So Dviguna Sayutam would be the Tailadaka, and it is 2 times, not 8 times, really speaking. Now these are traditionally prepared in a particular composition or proposition, and that might be different from what is expected. So we have to go to the original part and try to understand the percentage, etc. for that. So if this is available, let us try to use it in oral cancers. These are Mukhagata diseases, and in this Vagaldara RMD cancer hospital, they have a separate section for Gandusha, and generally Gomutra along with some decoction is given for Gandusha for all oral cancer patients, irrespective of the dosha, etc. etc. Now this is good for Kapha or Vata, not good really for Pitta, but they are giving it to everybody or something. And I am trying to use another Gandusha or Kavala, so to say, Dimbapatra Goduchi, that is Vata for Arbuda, given by Ashtanga Sangraha. So I started using it in oral cancer patients, and in oral cancer patients, and that works fine. But sometimes I put Irimidadi tail, sometimes I put Yashtimadu Gruta in that as a prakshep for gargles. So now it would be better if we start with this Nagaradi tail or Gandusha in this. And actually the part is big, it is more Ushna, and maybe good for Kapuvata, not much better for Pitta. We either go for Yashtimadu along with this, or don't use this, and go only for Yashtimadu or the oil, etc. etc. Particularly, there are varieties in oral cancer, tongue cancer, cheek cancer, then soft palate, hot palate, this tonsil, right? Some other varieties are seen, and sometimes the mandible gets involved in this. So, mouse, rakta, asti, and maybe Medha to certain extent. These are the dushas in this. पुढे अजून एक नागराधी तैल आहे 64 नंबरला. ओके, ते उपलब्ध आहे, हा पाठ उपलब्ध नाही. So this is not available. The other Nagaradi Taila is available. We'll see that part. And If not, we may try to get this prepared. And if there are users of this, then companies will prepare. So what I feel right now is we try to understand there is a vast scope for oral cancers. There are so many patients of oral cancers, and these really have very bad prognosis. In spite of surgery, radiation, and even after that chemo, there is a lot of suffering, and ultimately patients die. So the success rate is very low. At least if we are able to maintain the patient, then that is also fine. So if we really try to see, then this might be helpful. And we may also try to find out other medicines which are for Mukhagata Roga and such. So that L. Mahadevan sir's book, it's about 600 pages in English. I don't remember the name right now, but that is good enough for knowing varieties of drugs or varieties of conditions, etc. And we may learn which to be used in what condition, etc. It's like this Mama Ukle's book, Chikitsa Pradeep. And that book was brought into market by this Vaidyanamitra Parivar. I was surprised because how many people will be using that. But to my surprise, that is selling well. And it just gives the diagnosis, the type of particular disease, Vataja, Pittaja, Kafaja, and the treatment to that. And this has come from Mama Gokhale, and he was a very renowned practitioner. At that time, Darshan Hospital flourished like anything when he was practicing. There should be people who will be knowing El Madhavan's book. I'm not remembering right now, but anyway, what I feel, critical analysis of Ayurvedic formulations by El Madhavan sir. Okay, so this is the name of the book. So critical analysis of Ayurvedic formulations. So maybe this should be available, of course. And now there are many mobile apps which provide you information. My Mama Gokhale it is Chikitsa Pradeep, and that is also available. Now there are various apps also, and which give you information about the formulations, indications, etc., etc. So one can easily download and look at what is available in the market. Manjisthati Taila. Manjisthanu Jana Sarivabda Katuka Takkola Jati Phala श्रीकंठ त्रिफला जटा तगर रुख यष्टि चतुर्जातकैः यष्टि चातुर्जातकैः सोशिरा गुरु चौर युग्म मृगनाभी उत्पलाम्भो विसैः तैलम शिरो नेत्र शिरोर्तिहारी सपयः सिद्धं कुमारी रस. So Manjishtha Sariva Abda Katuka Takkol. What is Takkol? मंजिष्ठा रसांजन सारिवा अब्द मुस्ता कटुका तक्कोल तक्कोल only. जाती फल श्रीखंड चंदन त्रिफला जटा जटामांसी तगर रुक्पुष्ठ यष्टि चतुर्जातक उशीर अगरु चौर युग्म मृगनाभि कस्तूरी इंदुत्पल विषोत्पल अंब रिबेर अंभा अंभ बिस कमलनाल वंतलाई तैल कुमारी स्वरस्ट फोर प्रस्थ क्षीर फोर प्रस्थ. Prepare Taila with above drugs with calculate and Netherorog and Shirorog. Now, whether this is available in the market or not, and if available, whether it is available along with Kasturi, this is again very difficult. So, I don't think this is available in the market. Does anybody know about that? And what is the cola? That still remains a question. Balahata Taila. बलाहटामृताम उद्गमाशक्वाथे वाथैः तिलोद्भवम् वाथे पहिले पक्वम शिरोरुजुम हंति चंदनामय यष्टिभिः. जी सर ये टेलर याची प्राशन करायला आहेत का फक्त लावायला? मी दोन्हीला आहेत काय काही काही ठिकाणी स्पष्ट उल्लेख आहे पण सर्वत्र नाहीये. हठा इज आमलकी. बलाहटा अमृता मुद्गमाशक्वाथ and कर्कई चंदन आमय कुष्ठ and यष्टि. शिरोरुजम हंति चंदनामय यष्टि. So Shiroruja, this is good. Maybe you can use it in this migraine or other diseases. This Mudga and Masha combination, this is something strange. But this might be Tridosha Shamaka because Mudga is Alpachala and Masha is Vata Shamana or something like that. But it is Kapapitta Kara as such. But Vata Shamana, Balahata Amruta, Chandana Kushta and Yashti. And this is available even in Kerala. So coconut based is also available. So in some cases I have used this just because I didn't want to use Tila Taila. So may have to think about this Balahatadi. इथे उद्गव माश बीज घ्यावे की रोपटे. Difficult to say. But if it is Panchanga, then they would mention about Panchanga. Of course, it is possible. Paitika Shirshud. Okay. So might be just Mudga and Masha, not actually Bija, not actually the whole plant and such. मृगामलक रसप्रस्थे तैलप्रस्थं फलं मधुकस्य क्षीराडके विपक्वं बलाकामपि कोकिलं कुरुते. Bhrungamalaka, that might be, and why there is Rafar. Tailaprastham palancha madhukasya kshiradhake vipakvam balakam api kokilam kurute. So even balaka can become a kokila. So this should be very अंधम अनंधम कुरुते बधिरम अभिधरम तथा च चलदंतम वृद्धोपि उपचित पीनरसो भवति नरो मासमात्रेण. Very strange and very simple formulation. Bhrunga amalaka rasaprastha tailaprastha palam madhukasya. So that is the kalka. Do we get pure kushtha? I'm not aware, but I think it should be available by the name Koshtakolinjan. So this is Swarya, Netriya, and good for Shravanendriya as well, and Chaladanta, and Upachita Pina Rasa Bhavati Naro Masamatre, in a month. So Falashruti is quite wide, and maybe as we say, Arthavada. So let us see. Yashtimudu Taila Vrungaswarasa Amalakaswarasa Kshira. Pavityahara Swarya Chakshushya Badhiryahara and Chaladanta. Aged person will become nourished within 1 month. Palitya, I don't remember whether there was Palitya. So, Brungamalaka, is this available, Brungamalaka? Now, there is this proprietary medicine for Palitya. Brahmi, nahi, hai. Bhrungaraj Tel and Avala Brahmi, that is still different. Brahmi Avala. Yes, sir, SDM. Okay. So, we may try to see this. Andam Anandam Kurute, the Falashruti is quite wide. So, we may try to get this. And even Chaladanta, this is a good Falashruti. And for old age people, this is also good. Swarya, Chakshushya, Badhirya, and even Balaka can become a kokil. So, a good singing that is possible from Vaidyanath. यष्टिमुदला भृंगराज आमलकेची भावना देऊन दुग्धानुपान दिले तर उपयोग होईल का? Maybe try. But giving it with milk may not be that successful. I can't say right now. But Yashti, Bhrunga and Amalaki, this combination can be used. There is no doubt. And maybe we prepare a kalpa from this, like Shatavari kalpa. And Karunadath also, it should be helpful. Amalki and Bhrungaraj both are Rasayana. That is one important aspect. Or Yashtimadhu also, part of Rasayana as such. Whether this is available in Avarti form, that is another important aspect. Koshtakolinjan. So, Sahasrayogam Lappa is less available from some CCRS units are working on it. Pharmacy like Dabur also cultivation instead of Alpinia is sold in the name Koshtakolinjan. Okay. For internal use dose that we have to decide. Maybe we start with 10 ml, 20 ml, 30 ml or something like that. And we may go for Nasya, that's a better option. Nasayashira Sudvaram. So Nasya will be better option in this scenario. Anyway, we conclude today and continue tomorrow. Ayurveda prakando nigaditaiha hi shalyatantra pradhanaha शिष्येभ्यः शाश्वतोऽयं निखिलजनकृपा व्याप्तचित्तेन येन आयुर्वेदस्य वाञ्छन् पुनरपि भुवने तां च सुष्ठु प्रतिष्ठां श्रेष्ठं धन्वन्तरिं तं प्रणमति च सदा वैद्यवर्गो हि नूनम् वैद्यवर्गो हि नूनम् विरम्यते व्याख्यानव्यापारात् श्वः पुनरपि मिलिष्यामः।